Unfortunately, with self-harm, the evidence base is quite shaky. There was a Cochrane review done a couple of years ago, and they looked at a variety of different interventions like cognitive behavioural therapy, dialectical behaviour therapy, family therapy, etc. And quite surprisingly and disappointingly as well, they didn't really find much evidence of effect of any of the interventions they looked at, which was, really surprising. I think DBT came out on top, if you will, in terms of there was some evidence of that, but the research they were drawing from, they said was quite poor quality, so it was hard to draw any firm conclusions, really. But things that typically work well with interventions are things like helping to develop coping skills, helping develop strategies for regulating emotions without needing to self-harm, things like problem solving, communication skills, thought challenging, that sort of thing. And what works really well is taking a strengths-based approach. I think so often with young people who self-harm, there's a lot of emphasis on their deficits and what they're lacking. But I think what works really well is working with that young person to think about what strengths they have. And we know self-harm is a difficult thing to live with, so they do have strength. I think helping them to realise that and acknowledge that is a really helpful place to start.